Alrighty, that's the button right there. That's the magic button. It says we're going live. Hey, it says we are live on the YouTubes. Good evening, Westlake Charter School families, and welcome to our March kind of special edition of our Coffee Talk. My name is John Ike. I'm the Executive Director of our Westlake Charter School. Right below me on the screen is our principal.
Hi, it's Mrs. Kaya'u, your K-8 principal.
And just over on this side of the screen is our WAVE president.
I'm Amber Husted, your WAVE president.
And we have an amazing special guest tonight over here in the corner who will introduce herself.
Hi, my name is Dr. Amy Seacon Outwell.
And
nice to be here.
And Dr. Atwal, thank you so much for being here tonight. We have curated a list of questions for you talking about something that's right in your wheelhouse and your expertise. And we may even have a second guest on tonight, Dr. Kasiri, head of Sacramento County Public Health, said she might be able to make it tonight. And so we're really hopeful that we'll get both of you back on the screen to launch the show. So families, welcome to our Coffee Talk. We'll open up the show the way we always do. Tonight's a special version, so we're going to talk specifically about reopening schools safely. So our format tonight, obviously, as always, is we'll start with some celebrations. Then we'll dive into some information. We'll present tonight. Most of the presentation. Oh, there we go. We have a visitor here. Let me link that visitor in. All right, that was good timing. Let's see. Good evening, Dr. Casaria. Are you there? We see you there. Maybe you can hear us. Maybe you can't. Well, at some point, if you hear us, let us know, and we'll kind of continue with the show. We're super excited to have you here, Dr. Kasiri. Families, for you who are listening at home while we're still working out our special guests on screen, we will present information tonight about reopening school, and we'll do a special conversation tonight with our medical experts, Dr. Atwal and Dr. Kasiri, about COVID-19, transmission rates, schools, questions like that. We think that's going to be a great piece of tonight's show. And of course, throughout the show, we'll be doing a live question and answer. So if you hit that link right there, bit.ly.wcs Coffee Talk forum, you can ask any questions. We'll answer them live on there. Oh man, we almost had Dr. Castillo on there. Maybe she'll come back. And then of course, any questions we don't answer tonight, we'll throw out there on the website. Hey, if you want to start with some celebrations at home, throw a celebration out, and we'll throw it on live on air. Ms. Kai, you want to take this first celebration right quick?
Yeah, I'd love to. So over February break, we had the opportunity to visit a couple of schools on the screen here. And then we also invited them to come visit us virtually. So we walked their campuses. They have been open, many of them, since the fall of the beginning of the school year. And then they came out as an educator panel, and we asked them questions just about, like, what did it feel like to have kids on campus, and how did you set up your room, and all of those things. And they were just amazing presenters, and it helped our staff just to hear from other educators what it sounded like and felt like to be open again. And so we're really thankful for those partnerships of those schools and that they're willing to work with us.
Yeah, it was great. That educator panel was really helpful for our teachers to hear from other teachers about what it looks like when you reopen schools. That was phenomenal. I'd like to just celebrate our partnership with the Natomas Unified School District. A bunch of us have been out there from Westlake Charter School in the parking lot at Natomas High School helping out with the vaccination clinic. That's our board president, Hope Golick, and our student dean, Amy Wells. A bunch of us are out there every Thursday helping out with the shot clinic, and it's just been a really wonderful collaboration. We're proud to be a part of it. Hey, Houston, you want to talk this one through? Because it's kind of your jam.
Absolutely. So we put together a uniform swap, which has been incredible. There's really hundreds of items that were out last week that parents dropped off that might have been too small for their kids, and they were in great condition. And then parents were coming by equally and picking up some items that fit their kids and maybe their new sizes, or if they're new to our school. So it's just a great way to make sure we're helping each other out, especially this year when we're looking at, our kids haven't been in their uniforms for a year. We have one trimester and they're going to school 2 days a week. You might as well just go there, grab a couple uniforms so you're set. And so that will also be out on Friday all day from about 8:30 to 6 p.m. So be sure to drop off, pick up, stop by.
I love it. Thanks for doing that. That's such a big deal. We've been every day we have our staff involved in training. Dr. Atwal was part of that training. She came out, did a live panel via video with our staff so we could have our staff hear about safety protocols for reopening schools safely and asking good questions. Our staff have been out training on how we're going to open the gates in the morning, how we're going to help kids transition through campus. And it's just been a real celebration that we've been really, gearing up to come back to school. And so, Ms. Kaya, I know it's been a short riff, but are there any celebrations in the form that we should celebrate?
We have one celebration so far. Yes. So Carissa Johnson, which I'm just so excited. Let's celebrate our amazing teachers who may be feeling both excited and nervous. I would attest to that. Yeah. Like many of us, about returning to the classroom with students, they are very much appreciated. Thank you, Ms. Johnson, for that.
Yeah, thanks for acknowledging the duality of the excitement versus the, oh my goodness, what's it all going to look like tomorrow morning or Monday morning. So very good, very good. Well, keep those celebrations coming. We'd love to read them on air. And if you have questions during the show, we want some live Q&A. Now, Dr. Atwal, thank you for being here. You're kind of the mainstay of the show. So we're gonna start with Q&A for you, so you can go on and have dinner or whatever you got planned for the night. But we'll open up with some questions about returning to campus. Again, families, Dr. Atwal, could you maybe explain some of your particular expertise in this area? I mean, at UC Davis, you have a particular position that helps them stay safe at their place of work, and you've been kind of coaching us on our how to keep ourselves safe at work. Can you maybe give us your credentials a little bit?
Sure. So this is not my main job. This is a job that has come on because of the COVID pandemic. So in addition to what I normally do, but we have taken on case investigation and contact tracing for all UC Davis employees and students as a way to collaborate with our public health departments. So that has been a huge undertaking. And we have also launched our own COVID-19 testing for employees and students. We recently have launched a vaccination clinic. So we are really in the middle of all of this. So as a result, we talk about it day in, day out, think about it day in, day out. We're on top of it. So yeah, it's just been my life for a year.
Yes.
So,
yes. Well, thank you for doing what you do. And thank you just live on air from me to you in front of our community. Thank you you are so up to date on the latest research. Every time I talk to you, you're like, well, I just read a medical journal that stated this. Like, you have been such a great resource for our school and our school community. So I just want to say thank you. It looks like we may have a special guest. Dr. Casaria, are you there? Oh, she's right there. And it just must be an audio glitch on her side. So we can see you, but you can't see or hear us. I'm going to see if maybe her audio syncs up. Boy, Dr. Casaria, if you're there and you can chime in anytime and we'll give you the floor. Families, logging on right here is our Sacramento County Public Health Officer, Dr. Casaria, and she is brilliant. We get a chance to talk with her every Friday as a group of leaders in Sacramento from the education community, and she is just an amazing resource to our entire county, but specifically to our education community. We are super grateful. So, boy, I hope her technology starts hanging out with us here. No, she's gone. That's it. Darn it. Well, that's okay. Let's dive into some questions, you guys, and see what happens here. Dr. Atwal, I think I've got like 15 slides. I expected you to only have to handle half, but that's it. You're in the hot seat for all of them. If my student wakes up with any of the symptoms listed as COVID-19 symptoms, but I don't think my student's been exposed to COVID-19, is it okay to bring my student to school? Now, we have this listed in our handbook, but from a medical expert perspective, what advice do you have for us?
Sure. So many of the symptoms of COVID-19 overlap with many other medical conditions and health conditions. And so there's no real obvious sign that says, red flashing lights, this is COVID. So we ask everybody to err on the side of being conservative, that you assume that this could be COVID-19 and be evaluated by your primary care provider to ensure that it is not. There can be other etiologies, but you need somebody with medical expertise to determine that that is the case. So to keep everybody safe, it's best to be conservative and assume that if your child is not feeling well, it could be COVID, and make an appointment.
Love it. I love it. Yeah, and we'll talk a little about it later tonight on one of our slides. And, it says, hey, here's all the symptoms that we're looking for. If you got one of them, stay home until you're symptom-free for at least 24 hours. Was 72 hours. The ruling has now changed to 24 hours in Sacramento. Great. If you have 2 or more of the symptoms or any of the high-risk symptoms, they recommend right there on the decision chart, communicate with your primary care physician. Now, Dr. Atwal, speaking to other school leaders have said, hey, look, if a student, we're coming into allergy season, and your student's got allergies, and we know they're going to have the sniffly nose, they've been advised, hey, go ahead and contact your primary care physician in advance and say, hey, could you write me a note that says I'm probably going to have a sniffly nose? Is that kind of a normal operating procedure on your end?
Yeah, no, that's reasonable. Like you said, there are some symptoms that we consider to be more major symptoms, some that we consider to be more minor. But again, you really need somebody with medical expertise to tease that out. It really shouldn't be a parent, a grandparent, somebody like, oh, okay, they have this, they have that. How does this fall in the criteria? So yeah, if your student has a chronic condition that likely could flare up in the spring, I think it would be a good idea to speak with the primary care provider to have that letter written. Now, I think that primary care provider would probably also be able to give guidance as to when they should seek care so that, this is kind of what they normally experience. But if they're experiencing anything outside of these symptoms, that might be something that could be related to COVID or something else. So
it's good.
Yeah, a conversation would be worth it.
Yeah, that's super helpful. Thanks. It's kind of a home run there. What in general can our families do to help our school stay open once students return? We on the school side, we got the 7 layers of mitigation. We got the air filters. We've got everybody trained. We're all going to be wearing our masks, doing all the things. On the family side, what can families be doing to help our schools stay open once the students return?
Yeah, so you and I have talked about this a bit before, but in order for us to successfully keep schools open, it needs to be a campus-community partnership. So the campus is implementing various strategies to help mitigate the spread of infection, but infection will be brought onto campus, right? So we have to think about what are we doing in our daily lives that could be introducing that risk to campus. So it's really important to continue to wear your mask when out in public, to avoid large gatherings, whenever possible, to meet up outside where there is open air and the ability to kind of spread out. As things improve, I think people are going to be more inclined to want to get together, and currently the recommendations are still to be mindful of how many different households could be present at a gathering. Some people are vaccinated, some people are not vaccinated, so there's so many different variables that are coming into play. But again, if it's important for us to have our children remain in school and for schools to stay open, it behooves us to be as conservative as we can to be, to keep them safe. By making decisions that could be risky, we are jeopardizing a lot more than just our own personal, situation. So I think if we can all go into this together, realizing that we're in this as a community, and that the decisions that we make will not just affect us, but our entire school community, to hopefully stay open, I think we can do a good job.
I love that school community partnership language. I love it. Dr. Caceria, are you there?
I am here on the audio. I lost the video, so I don't know. There's something that my computer doesn't like Google Meet.
Well, we are honored to have you here via audio. Thank you so much for being here. For those who didn't catch it the first time around, Dr. Caceria is our Sacramento County Public Health Officer, and you've been such a great resource to our school and our community. So thank you for being here. We're going to just do some question and answer, and between yourself and Dr. Atwal, we'll try and get through all these questions and get you guys out of here on time in maybe another 10 or 12 minutes. This next question is regarding a new piece of legislation. We hear that Assembly Bill 86 has removed the testing requirements for schools, to reopen. The question is, how important is it to use asymptomatic testing for staff or students as they come back onto campus each week? Is that an important feature? Does either of you have an opinion on that?
I could start. I think I heard a little bit the tail end of what the doctor was saying about being conservative as we move forward, and I agree with that. That even though it's been made voluntary right now, I think it behooves the schools to at least have a plan in place for asymptomatic testing. I think, especially for the larger schools, I think the biggest challenge has been being able to organize the testing on a weekly basis for both students and staff. What I have been telling the superintendents as I've talked to them is that at minimum still maintain the access that we are providing through our community testing sites, and do encourage the staff and teachers to get tested on a regular basis. Right now, I think it's a bit difficult to figure out what that would be if you're not going to go by the state guidance of weekly. At least do it monthly. There might be new guidance that will come up, especially now that we're in the process of vaccinating school staff and teachers. So there might be new guidance that will state that it's not required to do the asymptomatic testing. Definitely testing for those that are symptomatic, and I think being able to make sure that you make the testing sites provide that information so that folks know where to go if they are exhibiting symptoms is important.
It's wonderful. Thank you so much. We so at Westlake Charter School, we have symptomatic testing in place on campus with some rapid response pieces with our partnership through Natomas Unified. All of our staff, we have that taken care of. All of our students and families, we're encouraging everyone to utilize our partnership with the Natomas Unified School District. We have free testing every Tuesday at Natomas Unified School District's clinic. There's literally hundreds and hundreds and hundreds of spaces available for people to go and get tested every Tuesday. Maybe your family does it every other Tuesday, whatever works for you. And we're also working out a potential partnership with a potential at-home testing kit through a company that we're working with. So lots on that. And thank you for talking about that, because with this new assembly bill saying it's no longer required, but we put all this work into saying we may use it. It's a great answer. Thank you so much. Dr. Kasseri, I'm just going to give you this one too, and then Dr. Atwal, I think I'll give you the next one. Dr. Kasseri, what are the current guidelines in Sacramento County regarding gathering with people outside of your household? Should I be attending a birthday party as I'm a first grader? Do I attend a birthday party on a Sunday, then show up to school on a Monday? What are the actual guidelines currently? Because I know they're changing with people getting vaccinated and things.
Those guidelines have not changed, especially for gatherings. So definitely birthday parties, because that's what got us in trouble in the first place last year. So I think we still need to be very vigilant about that. I know that the CDC recently released guidance, and the state is in the process of reviewing that and updating the masking mandate that is still in effect in California. But according to the CDC, I think, and probably the state will follow that guidance, is that for individuals from that are all vaccinated, they can safely meet. But we're still waiting for guidance of it, especially, for example, how many, and is there a difference in the length of time? But again, also to note that the CDC does remind that if you are in public, that you still need to wear the face covering, and you need to maintain the 6 feet of separation. I think a word of caution for everybody as we're going through this, as we're moving towards getting to herd immunity with the vaccination, is that we still have variants floating around. So yes, even for vaccinated people, the risk is, minimized. But I think there's still some, we still need to be cautious because they're still looking at whether there's any risk of transmission even from someone who is vaccinated, because you might be protected and you won't get sick, but are you still able to carry the virus to someone else. So I think it still behooves us to be cautious. Definitely, birthday parties should not be encouraged at this time. We also did ask the state about travel, especially outside of California, and right now they're still cautious about that as well because that travel will introduce new variants into our environment. So we still need to be careful.
Yeah. That's I'm hearing a lot of from our two experts. Being conservative is important. That's perfect. Thank you. And you actually answered this next question, which was guidelines for traveling outside of California. Thank you for kind of knocking that one out. So for both of our experts here, our students are coming back to school in class sizes ranging from 5 kids in a classroom to 12 kids in a classroom. Our school safety plans have been reviewed by the Sacramento County Public Health. How nervous should I be as a parent about the virus being transmitted to my student at school and bringing it home to me because I'm not vaccinated? That's a question from our parents. Can either of you respond to the risk here that we're facing?
Sure, I'd be happy to comment on that first. So there's a lot of medical research out there now that have looked at schools that have remained open or that reopened at some point during the pandemic. And with effective infection mitigation strategies in place, transmission within schools is actually very low. So by having everybody wear masks, by avoiding eating and drinking, being in close contact, hand hygiene, the smaller class sizes, they really haven't seen transmission. And when there is transmission, again, it's brought onto campus. So the exposure was out in the community. And generally, again, the decisions that we make in our personal lives are going to drive that. So I don't think that we can say that it won't happen, couldn't happen, but I think it's a very low risk if everybody is following all of the different infection mitigation strategies as they have been created. And if everybody understands their responsibility as well, and when they are not at school, to continue to follow the recommended guidelines by the state and our county public health department. And so I think that, from looking at the data, it's actually safer to be at school than it is at most places in the community.
Yeah, well, I mean, at school, we're going to make you stand on the dots. We're going to make you, stay 6 feet apart. We're all going to wear our masks, even if you're going to restaurants or hairdressers. I mean, are they as tight about the rules as a kindergarten teacher? I don't think so. I mean, our kindergarten teachers are pretty amazing. So, yeah, okay, great. I think that's comforting. This question says, my question is about students sharing materials in the classroom. For example, can students share books within the classroom? People want to know about materials and surfaces as vectors. So we're looking for the guidance for keeping ourselves and our students safe. So the question comes up, how risky is it for handing out papers, whiteboards, things like that? As a parent, I'm wondering, is my child going to touch materials at school and then come home with the virus? Dr. Casaria, maybe you could handle
okay.
surfaces.
I could start with that. Yeah. So one of the things we've learned about the virus with time is the fact that we know that the main way that it is transmitted is through the air. And we have learned that even though there is some risk of transmission from surfaces, it is minimal. And so, as you've mentioned, being able to have one book passed one from one person to another, that's minimal risk. But as was mentioned, again, reminding the students about the frequent hand washing helps. And also, I guess when you're talking about sharing books, you're not talking about two students sitting together reading the same book. I expect that what you're saying is a student passing one book to the next person, and that should be okay. But the frequent hand washing would help.
Got it. Yeah, we plan to play it very conservatively where we all going to only touch our own personal materials. But, I think doorknobs and things like that do come into play in this conversation as well. So I loved what you added on there. Regular hand washing, lots of hand sanitizer, and conservative, considering all the surfaces as potential vectors. Let's take a look at this one. This question is it important to report to the school or Sacramento County Public Health if I or any of my family member is exposed to or test positive for COVID-19? I mean, what if my students, was on school last week. I just found out. Like, is it important for us to share that information with Sacramento County Public Health or with the school? And either of you maybe could take that.
Sure,
I can. Go ahead, and then I can add to it.
I was just going to say that, for successful case investigation and contact tracing, it always helps to get this information. Anytime somebody tests positive, we have this process to try and identify who they may have had close contact with so that we can appropriately, notify them to quarantine and monitor to see if they have any symptoms, et cetera. So this information is part of our public health responsibility here. It's not just, again, about us, it's about everybody. And so if we have been exposed or test positive, I think it's important to share that information with our local health department and our school.
Yes, and as the doctor mentioned, part of the reason why there's been very low transmission in the school environment is because of that system of being able to identify and quickly isolate and quarantine. And that is dependent on getting the accurate information. So thinking about it, that if you're able to tell the school as a parent, then it really helps the school also make those determinations if there's been an exposure, if additional testing needs to be done. If everybody keeps quiet, then that's how the virus continues to spread, because people can pass it on unbeknownst to themselves and others around them. The other also, that the school is required by law to report it to public health.
Yeah, thank you. It's just so important for us to hear. It's such a community effort at this point. Dr. Casaria, I know that we're going to lose you any moment because you had a hard stop at 6:30. So when you have to go, you just jump off. I understand. Mrs. Kaya?
Yeah, Mr. Ike, before she does jump off, one of our families asked a question that I think would be great. We just talked about our families, the students coming to school and the transmission rate being low there. What this parent is concerned about is that maybe in the community, they might be seeing some families have children playing in local soccer league, and the league is having players, and they're not necessarily uniformly following health guidelines. It's just social distancing. Does the county do anything to ensure organizations are following those guidelines? And then they're just worried about their community. And so the question is can anything be done if youth sports organizations are not following the county and state health guidelines? If so, what? I think they're just saying hey, we're part of this community. So do you want to speak to that?
Yeah, that's been one of the hard things for us to deal with, because I do understand the enthusiasm around sports, but we also need to recognize that we're still dealing with a pandemic, and we have had outbreaks related to some of these sports. And most of the time, those outbreaks occur because, one, they're playing when they're not supposed to, and the other is that we've heard of actually coaches telling students not to say that they've been involved in games. We've heard about coaches telling the players that we'll give you the venue at the last minute so public health doesn't find out. I think that doesn't play well in terms of responsibility and teaching our students responsibility. So I think it's important for all of us to remember and to look at the bigger picture of what we're trying to do. Right now, I think the good thing is that the state has provided at least a way for them to be able to play, but also provided guidance in terms of testing so that we continue to make sure that everyone remains safe. So the guidance that is provided, we are dependent on everyone following the guidance, because I think we have to be honest. We're not going to call the police out to stop a game. They're not going to do that. I know we've had calls from time to time where parents are worried where they're seeing teams playing, and we've tried to talk with those teams to get them to do the right thing. But we do have very limited tools if people are not willing to abide by the guidance, and it does cause some concern. We've been dealing with some issues with tournaments that are going on the weekend, And then parents are worried about the students that have been involved in that and whether they are putting the rest of the students at risk.
I think it makes it
is.
Sorry.
Yeah, it is a huge problem, and all we can ask is that people think about the consequences and do the right thing.
It just really makes that case that this is a school community effort, that we've got to work together. Sacramento County Public Health can't go in and break up soccer games. They don't have that capacity and shouldn't have to. We as a community should work together as our school community and say, hey, let's keep it safe. So that's a great answer. This next question is about vaccinated people. It says, if a staff member is fully vaccinated and is exposed to COVID-19 off campus, what are the risks or the likelihood that the staff member is going to transmit the virus to a student who could then bring it home to a family member of a household where the family member is not vaccinated? So there is that concern. Can a vaccinated person likely transmit this to a student?
So, Dr. Kassiri, you mentioned this a little bit before. What we do know right now is the vaccine protects the individual that's vaccinated. It decreases the likelihood of them developing severe disease. It reduces morbidity, mortality. They're still looking at how much it reduces transmission to other people's. Hence the reason it's recommended that you still mask when you're in public. You avoid large gatherings because you can still be exposed to the virus, not manifest a lot of symptoms, give it to somebody else. I think, one thing I'd like to also pause when we say fully vaccinated, because there's a lot of talk now about vaccination. You're not fully vaccinated after one dose, unless, of course, you're getting the Johnson & Johnson vaccine. The other two are 2-dose vaccines. And even then, that full vaccination is not until 2 weeks after that second dose. So a lot of people think, okay, great, just got my second shot, I'm fully vaccinated. No, you're not quite fully vaccinated yet.
Great.
CDC has changed the guidance in that if you are 2 weeks out from that second shot and you do become exposed to COVID-19, that they are not now requiring that you quarantine. But they still ask that you monitor your symptoms and you still be vigilant by, wearing a mask and, again, all of the things that we've talked about. So we're still learning more. There was some data out of Israel a couple of weeks ago, preliminary, that it is looking like the vaccine is going to decrease transmission. But I think we need more of that data to say by how much. The variants are also another factor. We're monitoring those closely. We're sequencing all of the positives now. We're looking at, what variants are coming up and paying close attention. So the question is also, the vaccines will be effective against that, but does it reduce their efficacy? And there has been some, concern about that. And so there's just so much that we're still learning. So right now, if a staff member who's fully vaccinated is exposed, I don't think we can confidently say what that risk of transmission is. I think the hope is that it would be less than if somebody who's unvaccinated gets exposed and then, transmits that. And so it's still really important that staff member advise of their exposure and the school can decide what is best and be, vigilant about wearing their mask and monitoring for symptoms.
Yeah, that's the point I was hoping to end with was, regardless, the staff member will be masked, 6 feet of social distancing, vigilant about washing hands. We will still be using the layers of safety to mitigate any potential risk. And of course, we know about an exposure. We'll follow the proper exposure protocol. But those layers of mitigation, those layers of safety are important. Team, I have one more question here, and I promise I'll let you both go. Although I'd keep you forever. This is a wonderful. People are texting me on the side saying this is amazing. So thank you for being here. People have heard that the Pfizer vaccine is eligible for use for 16-year-olds. Any behind the scenes information that you have about when we think vaccines might be available for younger students? Is Dr. Kassiri or Dr. Atwal, either of you know?
I know that there are some studies that are being conducted, but I don't have a timeline on it, so I don't want to provide the wrong information. I don't know if Dr. Atwal has any information on it.
No, I would say the same. The trials are happening. In fact, I was trying to get information about, the ones that could be happening locally. So they're studying that, just like the vaccines that came out. It did take about a year for them to be able to monitor their safety and efficacy, and so we wouldn't want them to cut corners for our younger, students, and so we'll have to wait, I think, a little bit, but hopefully soon.
Mrs. Caillou, are there any burning questions from the audience? Because I promised our guests they wouldn't take. No, we're good. To both of our guests, you are just gifts to our community. Thank you so much for being part of our show tonight. We owe you one, so please don't be afraid to ask. Thank you for coming out and talking to us tonight. Have a wonderful evening.
Thank you for having me. Bye.
Thanks so much.
Thank you. Well, that was phenomenal. That was awesome. I mean, now it's just the stinky old three of us. Who wants to listen?
Yeah, that was awesome.
We're not experts in nothing. Boy, that was great. I don't know that we mentioned, but Dr. Atwal is one of our. She's a Westlake family member, so it is so wonderful. She has students here as well. We are going to talk through a couple of reopening slides just so that we're all on one page. Families, I know we're excited. We got kids coming back to school on Monday, so let's talk through it. Mrs. Caillou, me and you can tag team these slides. Families, we've been talking about this little slide that you see on the screen right now, and that we come out every week and say where we're at on the average daily or weekly transmission rate, and really the news is great. We are at a new adjusted case rate of 9.5 new cases per day per 100,000 inhabitants of Sacramento County. That is the lowest that we've been since November. We've not been in single digits in a long time. Great work out there. Keep it up. Keep your masks on. Keep your social distancing. So projected progress, right? We're not sure. We hope the rate continues to drop, but here's where we're at. Kindergarten through second grade opens up Monday morning, March 15th. We'll talk to you what that looks like. Third through fifth grade opens up March 22nd. And then so I put sixth through ninth grade. Oh, wow. A little typo, but it's true. We're going to have a ninth grade next year. Oh, my goodness. I love it. Well, we only have eighth graders, but sixth to eighth grade is after we're in the red tier for 5 days. And so that could, we're peeking behind the curtain. The people are saying that the county could be below 7 next week, and that will have implications for our opening. So we will be clear about our communications with our families as we go forward. But families in the middle school, it could be right around the corner. So everybody stay buckled up. Our classrooms are becoming ready. Our staff have come back. They've been getting their classrooms ready for our students to return. They're warm and welcoming. The safety protocols, our staff have been training and, writing the memos, reading the memos, practicing all of our routines. We are ready to go, and we're excited for your students to come back. And so let's walk through what that kind of looks like. We're going to answer 5 questions tonight, right? The who, what, where, why, and when. When do I come to campus? How do I come to campus? What do I need to do to prepare to come to campus? What will it look like? And how do I pick up my student at the end of the day? Mrs. Caillou, we're sending out an email tonight. Will you kind of walk us through? Actually, the email might be out already, but this is the when do I come? When do I know when it's my turn? What do they need to do?
Yeah, it's a great question. So we are having a communication plan, but if I'm a student A, it's going to kind of walk you through that if you come, you're an A student, you come on Mondays and on Tuesdays. All of our students will be in distance learning on Wednesday. So our first cohort of students will be Monday, March 15th. That's our kindergarten through second grade A students.
Right. So this is the example email on the screen now. If your name is Esmeralda Explorer, you're going to get this email from your teacher, Mrs. Awesome, and it says, hey, you're cohort A, show up on Monday, right? And if you're cohort B, it would say?
You show up on Thursday, March 18th.
Right. And we will get used to the cadence of this. We'll get used to the rhythm. In the email tonight, it's going to be a little reminder of what to bring to school. Wear your uniform, and then what not to bring. You don't need to bring a Chromebook or a computer. And please don't bring any toys to school, because if your student's holding a little toy, the student next door is going to want to grab that toy, and we don't want any materials shared. We got all the materials your student needs right here at school.
Hey, Mr. Ike, if I could just speak to this too. I know that I've been working with a lot of teams of teachers that you might be getting, this is from the school level, but a lot of teachers are giving you a personalized sample schedule for your child. So at Mrs. Houston's house, all of her kids might get an email that is exactly when they should be at school and what their day should look like each day. I've seen those crafted. I just worked on with Miss Alexander for middle school specifically, because there's a little bit of a different one. Right. Each one of the students will get their very own schedule that tells them when they are going to be in class. So wide level about saying when you're coming, but then look for your teacher to also communicate further details.
And Mrs. Caillou, I mean, there's layers and layers of detail, and they're all in the guidebook, and we've got the guidebook on screen tonight. But quick question for you, Jen. My child is in 5th grade, and they're not coming back until March 22nd. What schedule do I do Monday morning?
Yeah, you stay on your distance learning, your current distance learning. Next week, our 3rd through 8th grade students are still on distance learning. Their regular distance learning schedule.
Same one, the same lunch where I got 12 different lunches for 7 different kids, and but I stay on that because we're going to change when we change. So your schedule doesn't change until your kid steps back on campus.
You got
it. Just so we all.
No, it's a great question. I've been asked that question multiple times.
Oh, yeah, that was my question with the middle schooler, too. I'm like, so when the others are back, what happens with this one?
Right, and we decided, one change at a time. We'll change when it's time to step back on, right now. Good, yeah. And, hey, Houston, jump in with questions, man, because, you probably got an earful for some friends who were like, ask this one. So I love it. And Mrs. Caillou, maybe keep an eye on the FAQ as it comes through.
Got it.
So how do I prepare to come to campus? On page 7 of the guidebook, very first thing we want to tell you is everybody needs to do a pre-screening every day. On campus for the staff, we do this now, and we fill out a Google form that says we've done our pre-screening. Families, we are going to ask you every day when you show up at the gate, did you do your pre-screening? So just start practicing now. Make sure the thermometer's got batteries. Make sure you're checking for symptoms. It's right there on page 7. Mrs. Caillou, you take us through this next step in preparation?
Yeah, so every morning you'll do the pre-screening at home, but then when you come to the gate, you'll be asked those pre-screening questions at the gate too. Just to ensure that you are, that your family and your child is healthy to come onto campus, you'll do another pre-screening with the staff member to check in. They'll smile at you, and if any questions are, actually I was exposed, then we'll say, we want you to go back home, and we'll be in contact and join the distance learning group in the afternoon, and then we'll work with you. Or if you have a symptom, we'll send you back home. But we encourage families to stay home and participate in distance learning. If you have been exposed or you're having any symptoms, just stay home and let us know and join the distance learning group.
Yeah, you won't fall behind because we have distance learning every day. So here's the thing: if there's any symptom at all, you got to stay home until you're symptom-free for 24 hours without any fever-reducing medication. So no Tylenol, no Advil. So any symptom. But what if it's just the sniffles? Any symptom. What if it's just a tummy ache? Any symptom. What if I got a headache? Any symptom. Like that. I don't want to have this conversation at the gate, because we got to be clear, everybody. If your student shows up and they have a tummy ache, we have to send them home with you. So please, let's all work together on this. Same thing. If a student gets to class and they have symptoms, we have to follow the protocol. Any 2 symptoms or any high-risk symptom, it's okay to go clear that with your doctor. And that's what it says right there on page, page 9. Go read the guidebooks, because it's very clear. You probably can't see it on the screen, but it's very clear on the guidebook, so that we're following the same protocols. Houston, do you have a thought on that?
Sure. I had a parent ask a question that falls into this realm, is if I have one kid that has a symptom or 2,
it's a great
should
question.
I put all the siblings home?
Well, no. The reality is, when you're doing contact tracing, for example, exposure to exposure is not exposure, and exposure to symptoms is not exposure. Symptoms are symptoms. Mm-hmm. If you have them, stay home. If someone has symptoms and you've been exposed to them, that is not exposure to COVID-19. That's exposure to symptoms. If someone's COVID-19 positive and you've been exposed to them, that's exposure. So it's a great question, Amber. your brother's got a tummy ache, but you don't, you're cool to come to school. If that tummy ache turns out later to be COVID-19, now you've been exposed to COVID-19 and we'll handle it that way. And my goodness, like, we're all human people. We feel terrible. Like, I can see lots of tummy aches. I've been working at this school for almost a decade. Tummy aches happen all the time on Monday mornings for a myriad of reasons, especially when there's any anxiety. So let's try to, like, as best we can, smile, work through it. And if we got to go home, it's okay. We got to go home. Lots of people are going to go have to do distance learning while we work through this. Amber?
We've said before, if someone, say, does have a tummy ache, they can still do work at home.
100%. We built the schedule for exactly this reason. I'm supposed to be here on Monday morning to be in my cohort A. I have a tummy ache. Cohort B and the other students who are full-time distance learning are going to meet in the afternoon for distance learning. It's the exact same lesson. So you're not going to miss a thing. You're going to get what we're all going to get every day, so that every single day, all of my students are on pace with me as the teacher, never missing a lesson. Yeah. Gosh, you guys, we're all going to have to work together. It's going to be, we got this. We're ready for it. Mrs. Caillou, what else do we have to do to prepare to come to campus?
Yeah, this big one is what's happening this week is our virtual orientation. We put that out in the Westlake Weekly. We put it out in multiple places. And so our students have been participating in morning meeting and advisory, going over student hygiene, social distancing, bathrooms, morning break, like covering all of the things.
Yeah.
And we also just wanted to encourage families that you have that resource too to walk through, especially we just say, watch a video in the evening and talk about it as a family. Sure your kiddo, if they have any extra questions that they want to ask mom but not their teacher, right? Because sometimes we just want to ask that grown-up that's in our house and I feel worried. So please review it with them. They haven't been on campus for a long time, and so we want to make sure they feel prepared. So that's one of those resources for you. So
great. Sing that song at home. Wash your hands, keep it nice and clean.
My 3-year-old sings that song now, just so he knows.
I think I'll probably sing it for the rest of my life. It's stuck in my head now. Okay, that's what I do to prepare to campus. How do I come to campus? What's the drill here? Okay, see page 4 of our guide. Really, you got to go read this thing and check it out. There's a little map, and on the map we have separate arrival gates. So if you're walking to the campus from the west, which is where the park is, and you're walking, you're gonna come up to the walking gate in the flagpole. If you're walking to the campus from the east, which is the Maybrook side, you're going to pop into that first walking gate in front of the school between first grade and fourth grade, right? On my screen, those are those 2 gates there. If you're a drive up to campus, a drive and drop, you're going to get out of the car, enter into our little lineup, and you're going to come through the middle gate. So we got walking gates and a driving gate, and then kindergarten has its own gate around the kindergarten side, very purposefully. So if I'm a kindergarten dad, I can let go of that hand, that Velcro hand, and I can watch my little daughter walk right over into the kindergarten class. So we got a kindergarten drop-off just for kindergarten. We've got 2 walking gates out front and 1 driving gate, and the back gate is not open for arrival. It's going to be part of dismissal, so if people need to leave that way, we've got that. But we really need you to come through a gate that's chaperoned. So that's how we arrive. We're also talking separate arrival times, right? Kindergarten, please do not show up until 8:40. I know you got a lot going on out there, families, but we want to see a trickle onto campus, not a flood, because it's going to get jammed up at the gate. We got to keep people social distancing. Kindergarten, please show up after 8:40. First through 8th grade, you're between 8:10 and 8:30. And this is what I'm asking to help. Last names between A and M, like if you can show up before 8:20, and then last names N through Z, if you can show up after 8:20. I know that sounds, you're like, Mr. Ike, that's why. Look, you got hundreds of people that need to come onto this campus through a screened process. It sure would be nice if we could trickle into the campus instead of flood into the campus, and we think these will help. So we put this in our emails and in the guidebook, and to the best of your ability, help us out, families, because we want to make this safe. Mrs. Caillou, will you take this next one? Will you take this whole piece? What's going to happen on campus first?
Yeah, lots of wonderful things will happen on campus, but in regards to health and safety is that we will have 6 feet of social distancing outside, We're going to have 6 feet of social distancing inside. I've been walking this campus. Outside, there are dots everywhere.
Right.
But inside classrooms, these teachers have found their systems. Like, how do I get kids to wash their hands safely? The classrooms are all set up beautifully, 6 feet apart. They're all of their sitting areas. It's really impressive. Even the carpet space for the littlers, it's all drawn out for them in boxes, so the kids will be safe. So, in addition, is on campus you're going to have regular hand washing. We keep talking about that, but it really matters. They'll hand sanitize when they come on campus, and they'll wash their hands as soon as they make a kid in the classroom. When they go outside, anytime, even before they go to the bathroom, they'll wash their hands to leave. So, we're going to ensure everyone wears a face covering, and we wear it properly, that it covers your nose and it goes all the way down to your chin. We've seen when we did tours of other schools, kids wearing them the right way, better than a lot of adults I see in the community. They're rocking it, these kids. And so we will make sure and just positively reinforce for our students. And then we'll have these morning breaks, K-5. Our students will go out and take activity breaks, hopefully later on this week in the orientation and watch this as a family. It really is structured, but it gives kids a chance to socialize and to be outside and get fresh air. Our middle school students will take a break within their classroom for the time being when they enter on the campus.
Very good. Okay, that's what I'll do on campus. Houston.
I have another question.
Yeah,
Sorry.
good,
So,
great.
one of the main things I've heard from parents, including my own family, is anxiety. And not just kids, parents. Because, like, I have a first grader. She's 6 years old. She hasn't been on campus in a year, since kindergarten. And I'm like, do you remember where the first grade building is? And she's like, I don't remember anything.
Jen, you want to speak to the talk?
I would love to talk about that, Amber, but I'm sorry. I'll let you finish, and then I'd love to share a little.
That's what I would love to talk about, because I've had people say, like, can I have a map, like, just to show my student where to walk, because my student is nervous, or I feel really uncomfortable just dropping my kid off at a gate who's never been to the campus, maybe some of the new students. Yeah. So I think just kind of talking about all of our anxiety.
Great. Jen, tell about the map that we're sending home.
Yeah, so we'll be having a color-coded map specifically for our K-5 students, right? So we're like, hey, kindergartners have never left their kindergarten land last year, and so each of our buildings will be colored. So first grade is going to be yellow. So as a parent, you could be like, all of our students know their colors, and we will send home a color-coded map, and it will say, this first grade classroom, all first grade classrooms will be yellow. There will be balloons on the door. There will be, every door will be color coded. So when you work with your child to say, you're going to find the yellow building, and we will have all of our middle school team, our admin staff, all in the middle to really guide our students to be like, are you looking for the first grade yellow building? Let me direct you. So our whole staff is really invested in helping, because we recognize this, Amber, like I would be nervous too as a mom, right? That I was sending my little kiddos on campus, but we've really color coded it. You'll see it. We'll send you a map home, so you could say, here's your building. What color is your building? And so we'll be greeting them and helping guide them. And luckily we're doing K-1-2 at the beginning, right? So we'll all know, like, there's only 3 places you could go, and really making sure that, and some teachers are even like doing an outside tour right now, like, hey, this is our building. Right. Look at this building. See when you come in this gate. So we're working on it, but we're hoping the color coding can help families to feel a little bit more comfortable.
I love the color code there. It's genius. I mean, I just see all the yellow balloons and the yellow doors, and this building over here is all purple balloons and purple doors. And all of us in the hallway going, are you looking for the yellow building? I love it. It's so great. Mrs. Caillou, you and your team crushing it. So smart. Amber, I was going to speak to you because we had this question when we had a panel of teachers from all those other schools we visited. We said, hey, what did you do to reduce the students' anxiety? And the teachers were so funny. They said, don't worry about the students. It's the adults who have anxiety. They said, on day one, there was a little anxiety for kids, and it was like, gone. Like the kids in an hour were like, okay, I'm at school wearing a mask. It's school. And it was like, they just said definitively, we just have not seen students have anything other than normal, positive, relationship with school. And they said, the grown-ups took a little more to get there, But so I think me, you, all of us parents, all of us educators, will probably take a week to come down. The kids are going to take about 10 minutes. And I'm not belittling anxiety. I'm just saying they were so funny. These teachers were like, oh.
They'll be fine.
The kids are fine. So I thought that was pretty funny. Yeah, the great questions on the and the map. Jen, did the map go home in the email tonight, or?
It's going to go home in the arriving to school, so the tomorrow night email will include it in there.
Very cool, very cool. Sorry, that's right. That's right. Okay, and the last of the 5 questions is, how do I pick up my student from campus? This is a big one. You're kind of our SDM, school dismissal manager guru right now, and I know that the program has kind of changed from last year because now it has to include walking. It's a little change. Walk me through it. First of all, it's on page 5 of the guidebook. We are sending out videos via email tomorrow and guides, so everybody logs in. So I know there's more information coming, but could you just walk me through it? I'm new to Westlake. What's school dismissal manager? How does this all work?
First of all, school dismissal manager is the way that we will safely get your child from school to you. So that could be, there's a couple different ways that you will be picked up, but school dismissal manager is our hub, and you will pin your student into how they'll go home every day, right? So if your child is a walker, it'll tell us that your child is an independent walker and leaves by themselves every day. If your child is getting picked up in the car line as their default, then when you pull up into the car line, you will put in their PIN and it will pop up in their classroom, and we will send them to the curb to you at the car line. If this one is the different one this year. So if you are, because in years past, we love our families to come on campus and to pick up their kids, but we cannot do that. And so the way that you can do that, if you want to get out of your car and park and come and pick up your student, we will do that safely through the Maybrook gate. And so when you get to that Maybrook gate, which is over by the kindergarten, so if you've been a kindergarten parent, you'll come up there and a staff member will say, what is your PIN? And they'll pin in your child. So there will be a safe, one of the questions that came through, there'll be a safe kind of loading zone. So we have some protocols. We have dots all over our campus. So adults will stand on dots, and we'll have staff members out there to help with the organization. But you'll pin in your student, and that child, instead of going to car line, will come out and walk to you. You will pick them up, and you will exit campus. And so it's really important that the school dismissal manager is set up so that we can get your kids to you in a safe spot. The independent walkers are allowed to 4th through 8th grade, or if they're a younger student and they're walking with a bigger brother or sister, they will exit out the bike path gate, and they will be able to exit and go home that way. And so we have dismissal will be pretty tight. We're all leaving at 11 o'clock. But we feel like with our safety protocols and the way school dismissal is going to be run, that we'll safely get kiddos, and we will not flood them out. They'll trickle out because you'll be coming through the car line, you'll be picking up at the gates. And so it's really important that, again, I'll just put that plug in for school dismissal manager. And I know this because Amber and I talked earlier. Some of you have been having some hiccups a little bit, so work with our team. If you can't get in, please email admin at Westlake Charter. We'll help you to solve that problem. But it's really important. Your kiddo can't come out to you at the end of the day unless you have school dismissal set up. So please, if you need help, please reach out to our team. Yeah. We will call you. We will help you set that up.
So I want to be clear, though, Mrs. Caillou, my daughter's going to be an independent walker. She meets the qualifications for that. She cannot walk out into the parking lot. The only place she can independently leave this campus without parent chaperone is out the bike path, because that is our safe, independent exit. But if I want to leave campus with a parent walking, it's through that Maybrook gate by kindergarten. The only people going out the front gates, flagpole gates, is the car line, and I'm assuming students who are picking up their bike.
Yes, and when we say independent walker, that also does include our skateboarders, our bikers, our scooters, right? Because those kiddos are still able to do those things, but they'll be coming out that. Now, Mr. Ike, I don't think we talked about it on this slide, but we had a question come up in regards to lunches that I'd like to address, is that students will be able to pick up lunch. It will be at their classroom door, and they will pick it up, and it will be a grab and go to leave. And so all students will be able to have that opportunity to pick up lunch when they're on campus. But we'll also still have our lunch distribution if you're not on campus that day. So say I'm a B student, you can still come pick up lunch at school the same way you've been doing all year. So I wanted to make sure everybody knew that for sure.
And Jake, you, also that's for breakfast as well. On your way into campus, you can get breakfast. On the way out of campus, grab and go lunch. And everyone is entitled to a free breakfast and lunch, regardless of whether or not you filled out any paperwork or qualify for anything. If you want to eat, we've got food for you. So we'll,
100%.
yeah. Mrs. Houston, do you have a question on that?
Just a question about the lunch distribution. Will the time change so that it's not in the middle of dismissal?
That's a great question.
Melissa Grunholtz is currently working on that with our team because we want to make sure it falls within that 11 to 12:30 and so we'll be working on that. Right now it's 10:30 to 12:30, and we know that it's during dismissal, but we also recognize that our distance learning students that day also need to have the opportunity to come on campus. So we might need to move the location, and we'll make sure we let the team know. But so more than likely keep the same time, just move where they're offering lunch to the community.
Yeah, that's gonna be tricky because your parking lot's gonna get full. It's gonna look crazy out there. Yeah, good stuff. Hey, families, we really want you to go to the website and take a look at the guidebook. It is an easy read, lots of pictures, lots of colors. I want everybody familiar with this because if you wait until the day before and you read it and you have questions, there's a lot of pressure. You go read it tonight, then you can email us in the morning and we'll get back to you, right? So let's all take a look at that guidebook right there. And before we wrap up tonight, let's do the best part of the show. A little Wave Talk with Amber Husted. What's happening in Wave this week, Mrs. Husted?
We have some fun things happening. First, I just wanted to say thanks for the Chipotle fundraiser. We brought in over $300 for, grabbing some burritos and tacos and guacamole. So that's awesome. It pays for our science night and other activities. I wanted to once again thank everybody for the uniform swap. I think it's fantastic just to work together as a community to make these things happen. And I can't remember if we talked about the sock drive the last time, probably, but I dropped off boxes and boxes of socks at Loaves and Fishes, and it just warmed my heart. It was fantastic. It was so many more socks than I ever anticipated. Right. I should have counted, but it was overwhelming to count because there was so many. So thank you. That's fantastic. Science Night is coming up on March 31st from 6 to 6:30. It is limited to 40 families, and you can RSVP. That's in the weekly, and there's a link there. You can sign up. We're at about 20 right now, so there are still spots available. It's going to be a fun 30 minutes of, doing a couple experiments together. The items that you need are around the house, and I will be sending out that information to all the families who have RSVP'd next week with all the information about what to do, since we still have a couple weeks before it happens next week. So that's just a great night, and that's hosted by Sierra Nevada Journeys, who has been doing amazing science nights for many years. We've worked with them before, and they're just a fantastic organization. Our virtual international festival, we're starting to get a few entries in, and I'm really excited about that. That will launch on April 25th. We still need more volunteers. We want to make sure that as many countries and cultures as possible are represented. So please sign up if you can. If you aren't sure what to do, send me an email, but it really can be anything you want it to be. Some families are having their students just create some information about their culture, kind of just a document about it. And other families have created recipes, or they're doing a video. And so just make it whatever you want it to be. It can be as simple or complex as you want it to be. And be sure, even if you can't participate, that you participate at home by watching and looking at our gorgeous globe and learning more about all the Westlake families. And then I wanted to throw in here, Jive has a step challenge that's coming up that is really fun. And you have to sign up by Friday. So that's why I wanted to make sure and get this in here. Your student gets a free pedometer if they don't have one. And we will distribute those on campus on a Wednesday when we're not all there. So you can pick up your pedometer. It'll be really easy. And then we're going to have a steps challenge. And it's just a really fun way to kind of figure out how much we move and challenge ourselves, maybe to move a few more steps tomorrow. And it's just a great partnership with Jive, and I'm excited about that challenge. So make sure you jump on there and sign up for a pedometer by Friday.
Very cool. Yeah, wait, this is a jam-packed slide right here. I mean, there's a lot happening.
Like, this looks really full.
There's a lot going on. I love it. I love me some Wave, man. Thank you, Ms. Husted, for all the things that Wave has done and that you're doing and that you're about to do. It is all good stuff. I love the International Festival, the Jive Piece. You know me and the Chipotle fundraiser, big fan. Love me the guacamole. And we haven't mentioned it, but today is, what day is it? Wednesday. Tomorrow night's Thursday. We have a board meeting. But what's happening Friday night on the YouTube Live, people?
Talent show!
Talent show!
Everybody should watch. It's going to be so amazing. I got to preview it yesterday. It's pretty awesome.
It is
So excited.
really good, you guys. Look, one of the things I think is so neat is that there are some acts in the talent show that you just couldn't have done on the stage. Like, you can't really do a card magic trick on stage because no one can see the cards. But now, you know, so there's some things about this talent show that's even better than the live
It's
version.
really cool.
So,
yeah.
So yeah, you gotta watch the talent show for sure. Check it out, everybody. It's gonna be really fantastic. Gosh, I just love me some Westlake Charter School. Oh, Mrs. Caio, I was gonna go to the Q&A. Are there any questions?
There are a couple questions, and so one of them is, what if our child is having second thoughts on returning to campus? As of now, my son is set to return, but what if he changes his mind? We kind of talked about this earlier today about like opting in versus opting out kind of a thing. Can you speak to that?
Yeah, hey, thank you for opting in. And if your child is like, hey, I'm not sure I want to go, that's okay. You've opted in, and you can go to distance learning in the afternoon. But then if tomorrow, you're like, hey, I think I'm ready to try it, you can step in. Now, on the flip side, if you did not opt in, and that's okay, right? It's a very personal decision. If you did not opt in, I'm going to ask you to try again April 26th. The teachers have been doing a lot of work setting up the classroom for exactly the number of kids who said they wanted to come back. They're making the little name tags. They're doing all the materials in the class. So I don't want people... I can't have anybody change their mind right now to come back because we've already got the teachers set up. We're trying to get classes all balanced and that. So for those of you who said you're going to stay on distance learning, stay on distance learning. Watch what's going on. Get a feel for it. And if on April 20, just right after spring break, if you feel like you're ready to come back, then we'll bring you back in and you can come back. On the flip side, if you've signed up to come back and you're just not feeling ready, you can sit out, and that's okay. If you would just communicate with your teacher, and there will be, hey, no harm, no foul. Again, if you're like, I just really want to sit this one out, that's okay. We'll do this, and we'll do it as a community. And you can see in that community agreement that we sent out to one another that staff, families, we're all going to agree to that community agreement. And one of the agreements is we're just going to give each other grace. And we're going to assume positive intentions, and we're all going to, ask good questions to understand before making assumptions. Like, we're just going to work together, families. This is all of us working together. So yeah, it's a great question, Mrs. Caio.
Yeah, it is. I liked it too because I'm sure other families might be having that same question.
For sure.
Another question is about the restroom, and I will speak to it. And I'll also reference and tell families too. There is a whole video on how to use the restroom and our protocols and things. But this one is only one student at a time will be able to go into the restroom just to keep it clean and making sure that no one is 6 feet social distancing. And so we have some great protocols in place where there will be a passport on the door that is disposable. And so we want to make sure that, that you put that on, the student will stand outside waiting on a dot safely. So there are protocols that will come through, but yeah, there will only be one student in the bathroom. And if all students follow that protocol, it's really, it will help us all stay healthy and safe. And we'll also be keeping kids in their own bathrooms in their buildings, right? To try to keep students from spreading throughout the campus. But
right. Yeah, I love it. Second grade use second grade bathroom, first grade use first grade bathroom. That way we know where you are, only one person at a time. That way we never have to do any contact tracing because I was never in the bathroom with anybody else because the bathroom, I'm only in there by myself. Love that. How do I know someone's in the bathroom? Because you have a disposable sticker that goes on the door on my way in, and on the way out, I take the sticker down, throw it away, and go back to class while singing the wash, wash, wash your hands song. I love it. Any other questions that are coming in, Jen?
There's one other question, and you might not be able to answer it on stage because it's brand new information, but this parent said, can you project how today's $30 billion American Rescue Plan pass funding for SEAs and LEAs, including after school and summer learning, might impact the opportunities at our school?
Well, I could do an hour on this, right? Because I'm a bit of a nerd, but we probably shouldn't unpack it too much. I'll give you a couple of highlights, right? So Assembly Bill 86 in California kind of comes out, passes, and allows for some extra funding for all schools, which is a real gift, for all of us, because it is going to be expensive to not only reopen schools safely, but to keep schools open. And a lot of that is projected through the fall as well. Like, here at Westlake Charter School, we have not 5 kindergarten classes like we always do, but we have 6. Why? Because we're trying to get our numbers down. And we don't have 4 fourth grade classes and 4 fifth grade. We have 5 fourth grade classes and 5 fifth grade classes. Well, that isn't free, right? Because you need an extra human being to run that classroom. I mean, our labor costs are literally 75% of all costs. When you look at our $10 million annual budget at Westlake Charter School, you go, gosh, what do you spend all that money on? They spend it on people, right? The people are the main cost in education. We're not a highly mechanized workforce, right? We're all human. So that's great. We got some California funding that's going to come our way that we're doing some analysis on. We'll be talking about that at the board meeting tomorrow. If you're kind of a finance nerd, please join us. We'd love to talk. We'll be talking budget tomorrow. Now, the federal stimulus money is interesting, right? Because as we project that, we went to a seminar this week on that. Most of that is tied to Title I funding, which our school does not qualify for. So you're going to see some schools in our region, and like Natomas Unified School District, our authorizing school district, whom we have a wonderful partnership with and we love. We project that they're probably going to get roughly $17 million of funding, and we'll get 0. And that's okay. It just means you're going to see different things in the community. What they're able to do with that money, we won't be able to do because we won't have that money, but that's okay. All the things that we're telling you that we're going to be able to do, we're going to be able to do, and it's all projected in our budget. We've also got a healthy reserve, and we're a really good organization financially, and so we're in a good spot for this. We are going to be able to reopen safely, cut no corners, really invest in health and safety protocols, and all the way through the end of next year as well. But yeah, the tracking the legislation is fascinating. You may have heard me allude to it earlier tonight. For example, AB 86, Assembly Bill 86 comes out and says that the asymptomatic testing is no longer a regulation that's mandated now that we're opening under these new protocols. If you read that, I think it's like on page 11 of the bill itself. It's fascinating. There's so much. So enough. I could talk at length about it. It's a great topic. If you have any very specific, line by line questions about it, please email me, or if you want to jam for a cup of coffee, I'd love to talk about it, or drop it in the board meeting as well.
Yeah, that's great. Thanks, John. Those are our last questions, okay. But I did want to. I skipped a parent celebration that I'd like to go back to.
Let's end on a celebration.
Cassie said, "Thank you, Mr. Ike, for your tireless leadership and dedication in these uncertain and unprecedented times. You instill confidence, and I appreciate that you have the best interests of WCS students and teachers at heart." And then Karen Zedek also said, "Thank you for all the information." So I just wanted to make sure that they knew that we heard their voice, and we appreciate you too, also parents, and thank you for that. And I would reiterate, Mr. Ike, we are thankful for your leadership. I think I've worked years with you, and you help us, and it's been an interesting year, and we appreciate your hard work and dedication to make sure that we're going in the right direction. And we're excited to open school. It's part of our, as we get ready to launch, we are very eager to have our explorers on campus on Monday.
Yeah.
And it's fun to see all this hard work come into action, and our teachers are excited, and their classrooms are ready, and we're excited to bring your explorers back on campus. So thank you, families, for trusting us.
Thank you, families. Thank you, Mrs. Caillou. But all the kudos belong to the entire team effort. I don't know how other schools particularly roll, but I do know that sitting here live on YouTube with our school principal, our parent organization president, having Dr. Kassari and Dr. Atwal, what a demonstration of our mission statement and our ability to collaborate with our community. Everything that's successful at Westlake Charter School has nothing to do with an individual. I appreciate the kudos and the shout out to me, but man, it isn't me. This place, more than any place I know of, is all about the team and our teacher teams and our staff member teams and our parent teams, our student teams, and our community has really done an amazing job, and I think we're going to crush it bringing kids back onto campus. It's going to be beautiful, and we're going to do it well, and I think we're going to all feel that joy that's been, maybe it's been present, but it's been a little missing from the in-person part. So, hey, thank you, families, for tuning into the show. We certainly appreciate you. Hit us up at admin@westlakecharter.com if you have any questions at all. Thanks for staying tuned. And as always,